I'm Lucy Rojas. I'm a perinatal sonographer at Austin Area Birthing Center. So I've been interested in healthcare for a long time. I was a competitive runner and was doing massage at the time and decided that I wanted to do something a little more challenging. And so I went to ultrasound school, ended up at St. David's, and they taught me everything I needed to know about ultrasound. And at one point during my career, about a year in, they asked me if I wanted to do pediatric or train in obstetrics. And so I made the choice to go into OB, and it was one of the best decisions that I've ever made. They trained me from the ground up, and the maternal fetal medicine doctors that I worked with saw me and my images and decided that they wanted to put me into the clinic and work in high-risk OB. And so for the last 9 years, that's what I've been doing. I've been working with maternal fetal medicine doctors and working with patients that are low risk as well as high risk. And it's been very challenging, but it's been super rewarding to be able to do that and be able to see what's natural, in life and something that's growing inside of mom and be able to give that experience to them. I'd been scanning ultrasound with adults and pediatrics already. I was in the NICU scanning patients. And so for me, I found that it would be even more challenging to scan a baby that was moving and go through that process with a patient and go throughout their whole pregnancy, versus just seeing a patient and looking at a diagnosis or, finding something or scanning them, and then I wouldn't see that patient again. I like to get to know my patients, and that was one of the big drivers, was being able to help them through their journey. I think one of the most rewarding things is, being able to help the patients whenever we do find something that's abnormal and go through that process with them and teach them about what I'm looking at and help them understand what's going on in their bodies. So that's one of the most rewarding things is, being able to connect with them in that way and help them connect with their baby before they're even born.